Hello, everyone. Welcome to part 2 of Innovative Examples of Integrating Nutrition and Health in the nonprofit sector. We have 3 great panelists here to talk about some of their work and some of the challenges facing the nonprofit sector. So I think I want to start with Rick Whitted, who's CEO of U.S. Hunger. We just heard this very inspirational talk from Congressman McGovern about how this is a very exciting time and things are really going well. I wonder, what do you see from your perspective, and tell us a little bit about what you're doing to address some of these problems.
Sure. It's interesting times, and I think it's transformative times. There's a lot more excitement to come, hopefully, when you look at the collective work that we're doing. U.S. Hunger is more than a decade-old community-based organization that initially collaborated with tons of organizations and corporations across the country for coordinated meal packs. Well, that went away with the pandemic. About 30 days into being the CEO, 90% of our revenue was gone, and we had to figure out what is relevance. And I think that the biggest shock to us was realizing after years of trying to get food to places of famine that we didn't ask the most important question, which is, why are they hungry in the first place? So we started asking, and our full cart program, which ships fresh produce and shelf-stable meals across the country, was that vehicle. And we were grateful to have partners that said, we need to feed people in the pandemic, we need to feed families and children, so let's use that program, which had just been in its pilot stage. Well, we just, at the end of every registration form, we asked one simple question: how would this box of food help you? What we didn't realize, and if you fast forward 3 years later, now with almost 170,000 of those screenings, we have a mapped lived experience. They all come with not just health-related social needs questions, but they also come with that question answer, which is a testimonial. So we have this interesting combination of qualitative and quantitative data, very large volumes we've been tracking with the CMS. And so as of this year, that data includes the entire HRSN survey that CMS has used. So the short answer is it's getting rougher for the families that are reaching out to us. The stories are indicating that basic needs are just very difficult to meet, and it's tough for a food organization because we realize we'd been splashing in the downstream puddle of food, never going upstream to try to connect the two together. And so it's interesting when you see those stories telling you what's going on.
What are some of the one or two of the key data points?
97%, very difficult to meet basic needs. Literally, 97%, 92% are skipping meals, 60% housing inadequacies, 60% are dealing with other issues, almost 60% chronic illnesses. They're self-reporting. The top 5 are arthritis, hypertension, diabetes, obesity, which in early 21 was in the top 5. In 20, it was in the bottom 20, and now it's number 3. So we're seeing that move. So probably most shocking is that they're eating. They're just not eating healthy because they can't afford it. That's what the stories are telling us.
Well, I think we'll go to Lauren Smith to ask you about this. Lauren's a pediatrician, and she's also Chief Health Equity and Strategy Officer at the CDC Foundation. And Lauren, let's talk a little bit about that, a little bit about your work too, but also sort of this difference between food insecurity and nutrition insecurity.
Yeah, I'm really glad we're going to be able to dive into that, and it came up earlier. First of all, for those of you who don't know, the CDC Foundation is a independent nonprofit that was developed more than 25 years ago to support public health in general and the CDC's goals in particular. But in terms of the distinction, I think, and I think it was, Darius, you talked about it earlier, the distinction between having enough calories or having inadequate amount of calories versus the nutritional content of the food that's being consumed. And so it's quite possible to to have adequate calories but be nutritionally insecure. And so I think this expanded conversation about what does nutritional insecurity look like versus food insecurity, I think, is an important distinction.
Mm-hmm. Yeah. Oran Hesterman, founder of the Fair Food Network. Thanks so much for being here. And I tell us about your work and especially what you've been doing in terms of nutritional insecurity.
Thank you so much. What a pleasure to be here.
Thank you. Got to lift it up, I think. There you go. Try that.
Okay, better. Great. Well, what a pleasure to be here, an honor to be here today. The Fair Food Network is here to grow community health and wealth through food. And I want to talk just for a minute about how we see food as medicine fitting in with our work at Fair Food Network. Most of the conversations today are about how food is medicine for individual bodies. We approach it as a system, that the same food we need as medicine for our human bodies is the same food we need for the health of our Earth's body and for the health of our communities. And so we really need to see this as a systems approach. And I'm very proud of the work that many of us have done together over the last many years in the food as medicine work, especially in the area of nutrition incentives. So at Fair Food Network, we call it Double Up Food Bucks, and simply SNAP participants have the opportunity to, when they spend SNAP money on fresh fruits and vegetables, they get additional money. Spend $20, get $20 additional dollars. Go home with $40 of fresh produce, and with a priority for locally grown produce. Now, nationally, this is now called the Gus Schumacher Nutrition Incentive Program, named after Gus Schumacher, a good friend of many of us, especially here in Boston. With Double Up Food Bucks, we see this as a win-win-win. It's a win because families are bringing home more fruits and vegetables, more healthy food. Farmers are getting additional income from the food that they can sell, and those dollars are staying within the local economy, helping to create economic activity, jobs, and income. So this win-win-win is an important way to think about food as medicine. What I like to say, and some of you have heard me say this before, you can either pay the farmer now or the doctor later. And at Fair Food Network, we believe that we need to be paying the farmer now.
Very good. Nice. I wonder, we're hearing a lot about different approaches to dealing with the problem of food insecurity and nutrition insecurity to some degree today. But it seems as if there are a lot of different groups doing it and not sort of one cohesive effort. Would you call that a big obstacle? And if so, if not, what is the obstacle? And if so, how would you address it? What would you say, Lauren?
Well, I think that you definitely put your finger on it. And the CDC Foundation has been thrilled to partner with the White House to gather commitments and involvement in the conference that we've been talking about today, but also as a follow-on to figure out how do you maintain that momentum. And one of the things that we're looking to do is definitely not recreate anything that's existing, but what kind of action collaborative could be developed that would bring folks in from all the different sectors that you all have talked about, including healthcare, to be able to sort of maintain that momentum, to leverage best practices, to ensure, as we heard in the prior panel, that community members aren't just advisors to something, but that they are truly the deciders. So not just advisors, but the deciders. So that level of community activation and engagement. So we're looking to partner with folks to be able to do that, and that's a major thrust of ours, is to develop that action collaborative that will be a big tent that can include both private, public, social sector.
Is that a big challenge, Rick, would you say? Sort of coordinating all the efforts, or how do you describe a main challenge for you?
I think there's a couple of things. We're very siloed in our approach, and there are some major players that really, when you put them all together, like we actually have all the answers. We literally have all the solutions. Everyone just remains silo, and the silo widens the further you go down the who doesn't have the money and where does the money start at. And so from that perspective, you see healthcare major player, and we're engaged quite a bit with healthcare because 85% of our applicants have health insurance. And by the way, 40% are commercial plans. We are seeing this creep up into the middle class quite a bit. Very different from what we thought without the data. And then there's the government and there's nonprofit. So when you look at all of those issues, when it comes down from a CBO perspective, Oran and I were in the back, we're talking, we're like, what is the problem? We said, well, number one's funding, number two's funding, and number three is sending us folks without funding, right? And so when you think about the fight in food insecurity to this point, which is why I'm so excited about this conversation, like the business model for fighting food and nutritional insecurity is begging for money. I mean, when it gets down to CBOs, that is not sustainable, just the nature of the model in and of itself. So on the one hand, that's an issue for community-based organizations who have the relationships, who have the intimacy and can get the data. On the other hand, it's data, right? So there's a lot of investment. I can get a lot of folks talking to me and U.S. Hunger about food and how do we get you more food, but not about data, not about technical investments we need to be able to, or just modern technical things that would allow us to run nonprofits and community-based organizations like the best brands in the world do. And we made that choice to invest in the downstream of the pandemic into data so we can understand, because it's really not data, they're lives. And so I would say those are two very siloed areas. The funding is not clear. It is focused on the loudest solution. And then data, you cannot determine good ROI without good data. And so the community-based organizations have these relationships. They get these stories. They need help better documenting it. They need help better aggregating the data. They need help better understanding what are the right questions to ask and how do we connect that upstream to healthcare, to the universities, to government.
And that would help.
Quite a bit.
That would help address these obstacles that you're seeing. Yeah.
Yeah. It's not. What we'd find out is it's not about food. There's a collective ecosystem has to be addressed in tandem.
Right.
Yeah.
Oran, I know you mentioned the Double Food Bucks program and a potential solution, and we all know food in general is expensive, and healthy food is very expensive. So that's one way of addressing it, but is that a primary issue, would you say, in terms of making sure that people can get the nutrition that they need?
So when we early on at Fair Food Network did our research to see where the most important work for us in this field would be, the two answers we got back from the community were all about access and affordability. So how are we going to create greater access, which is one of the reasons why the Double Up program is now not just at farmers markets, that's where it started, but now in grocery stores and expanding to different kinds of retail operations. Access is important, but affordability, as you said, is really primary. Rather than barriers, I think of opportunities. And I agree with you, Rick, that one of our opportunities is really that to weave a tapestry together is through research efforts. That we need better evidence that connects the food system work with the health system work so we can bring together resources from food and agriculture and healthcare together. The other real opportunity has to do with public policy that can address affordability, accessibility, health. What we're really talking about is transforming a system here. And I cannot imagine how you transform a system without shifting public policy. And we have some great opportunities ahead. One opportunity coming this year is with the Farm Bill. And many of us can work together to address issues in the Farm Bill that can create greater accessibility and affordability.
If you were approaching me, Rick, with a pitch of why I should invest in food as medicine, what two data points would you tell me in terms of the return on my investment?
It is nutritional insecurity and accessibility and affordability in one. So the best stat that we've seen monitoring this through the pandemic the last 3 years is obesity. Obesity went from being 19 on our list in 2020. By March of 21, literally 12 months into the pandemic, officially, it moved to number 5. Last year it was number 4. This year to date, and that's with 30,000 applicants, it's number 3.
Wow.
So folks are figuring out how to survive. And when you combine that with skipping meals, moms and dads and grandmothers, which are moms 2.0, are skipping meals to make sure the kids are eating. They just cannot afford it. And so if you do not look at food as a major issue, you're going to worsen the plight of those very folks who are in the room talking about how we help them.
One thing I would add, and again, sort of pulling the threads from prior panels, is this opportunity for food as medicine and sort of the broader healthy food system to be an economic engine and an economic driver. So we heard about it in community, you talked about it with farmers. There's many states where farm councils have become the mechanism through which people are having these conversations because, regardless of, it's a bipartisan kind of situation to be supportive of, farmers and, especially, independent or farmers. So this idea of driving economic, not just inclusion, but economic productivity and economic sort of vitality is, I think, another way of getting people, into that conversation.
A data point that we have from evaluation on the Double Up program is that for every dollar of nutrition incentive money that's spent in a community, there's about a $3 multiplier effect of economic activity in the community. So I think you're absolutely right, Lauren, that we can see food not just as something for individual health, but for economic community health as well.
I wonder, with increasing attention, as it seems, there's a lot of activity in this space, there's a lot of attention in this space, that for-profits will be attracted to this, as well as nonprofits. I wonder how you think it should be balanced to make sure that for-profits would approach this in the same sort of holistic way that nonprofits might, and how do we make sure that that's being done the same way, or what are your concerns about that or advice about that? What would you say? Lauren, would you like to go first?
Sure. I think we heard also in the last panel about the importance of understanding and discernment. So the way that nonprofits or healthcare settings do the universal screenings, do that kind of assessment around what people's needs and assets are. I think when for-profit entities come into the conversation, that it would be really important that holistic stance come with it, because only asking like one question about the food insecurity is not going to then identify the associated housing instability or other aspects of economic instability potentially, or other sort of issues. So I think I would encourage a holistic and comprehensive approach to it, regardless of whether or not it's being done by a for-profit entity or a nonprofit entity.
Yeah, I'd agree with that. I'm actually very hopeful in this area. We're in a lot of conversations with a variety of for-profit organizations who really do want to help. They really do want to understand. One of the things we hear from them constantly is, we just don't have the data. We get a lot of anecdotes that are kind of passed off as data. Anecdotes aren't data. But we don't have the data. They're still a for-profit, so they have to be able to see the return on investment, even if it's a social return on investment. And that's why I'm so passionate about, we have to arm the CBOs with that ability to tell their shareholder story, their stakeholder story and show their impact, their social impact in real time. Because there are corporations who really welcome that, and they know how to take that impact and laser it into their market focuses, which are all local and can be very different locally.
What would you say?
I mean, the way I see this is that at the end of the day, both the food system and the healthcare system are market-based. I mean, that's what's going to transform what we're talking about. It's not, nonprofit organizations are not going to transform the systems. It's going to be transformed because the marketplace becomes in alignment with some of the values and approaches. The role of the nonprofit sector, in my belief, is to innovate, to test, to provide the evidence, and to show both the public sector of government and the private sector models that work, so then we can work together to expand those models. And that's why we're really pushing on nutrition incentives so hard, because we know it's a model that works. And now it is time to figure out how to expand that model, and it's only going to work if government and the private sector works together with nonprofits.
Are you concerned about that at all, about the private sector getting involved without some guardrails?
I mean, listen, we've got partnerships with retail grocers all over the state of Michigan and now increasingly all over the country, and they're good, powerful partnerships that are benefiting everybody. So it can work well.
Rick, of the lessons that you have learned, what would a main lesson be to other nonprofits who are either in this space already or thinking about it?
Yeah, collaborate. The problem's way too big, and we all know it. You know, the Orans and my organization, we know it. The problem's way too hard, and so resist that urge to silo, right? And unfortunately, oftentimes, the grants and the grant processes themselves silo you, right? If you told this guy and this guy, okay, we're going to give you $1 million. Key, you two have to work together and figure out a model that works. Guess what would happen? We would figure out a model that works. But grants don't do that. They lean to one person. Even the second organization is like they can be listed as a supporter, almost like a vendor of the process. And so we have to resist that urge to collaborate instead of silo.
Okay, anybody listening, $1 million right over here?
Or
and
2 million,
they'll
or
figure
3
it all
million.
out for us, okay? Want to thank you all very much. This was terrific. We're out of time. I'm sure we could keep going. Thank you.
Another incredible panel. I want to especially thank Deborah and all of the panelists for their work.